A community for 100 years.
It is bitterly cold outside, so if you are lucky enough to have a nice warm home to go home to, I'm sure you're giving thanks for that. This is Joe Brackett. He's with the Homeless Health Care Center. Did I say that right, Joe?
That's right.
Okay, good to see you this morning. You're here as the outreach coordinator, really, for the homeless population, because for those folks, it's difficult to find shelter in this cold weather.
Yes, yeah, it's bitterly cold. It's miserable out there.
So talk about the pervasiveness of the problem, if you don't mind. Then we'll kind of get into the particulars of how people can help and what you need. But as I understand it, especially since COVID, the homeless population has actually increased, not decreased.
That's correct, yeah. And so there definitely has been a noticeable increase. And we can also point out the fact of unaffordability as far as housing goes. And so we're starting to see more and more folks enter into this predicament of homelessness that have never been in this situation before and truly don't really know where to go, what to do. And so that's why agencies such as Homeless Healthcare stands where it is and offers the services that we offer as far as our primary care health services to kind of address those chronic health conditions that exist, and at no cost to people who are currently experiencing homelessness, don't need any documentation. We also have case managers who can also identify local resources that people are in need of and provide those connections.
Where are you based?
Sure, so we are right on 11th Street. If you're familiar with the Chat Foundation, or used to be known as the Chattanooga Community Kitchen, we're right across the street from there. So our address is 730 East 11th Street, and it's a brick building with glass windows, and we're open from Monday through Friday, 7:30 to 4:30.
So the people who you see there, first of all, they're coming to you then. You're not going out into the community. Is that correct?
So as far as all my other coworkers, that's correct. But
Okay.
as far as what I do, I am the outreach worker, outreach coordinator, and so I don't spend very much time there at Homeless Healthcare at all. I'm actually all throughout Hamilton County visiting a different area of town each day of the week. Like when I leave here, I'll be going to Hickson.
Are the people who are coming then to receive this care, are they kind of, Joe, what a lot of us will think of in our minds? You know, you hear about the homeless camps that are here in town. We all see people and our heart break when we see them walking with a buggy down the street. Is that who you're helping, or is it people who we don't know are homeless but they are because they're living in their car?
I think it's a good mix. I would say it's about half and half. Folks that are currently unsheltered and may fit the unfortunate stereotypical look of what we see in the media of what homelessness looks like. But we also see another half of that where we have folks who, yes, are living in their car or living in one of the other family shelters in town, or maybe just doubled up with a friend or a family member.
Couch surfing, they call it, right? Which is a very real thing. You mentioned the price of housing. It's become a real struggle for people, and what are they supposed to do?
Right.
Talk about what people can do to help you then, because you don't really need volunteers, but I imagine you're always in need of some supplies.
Sure, yeah. So I'm a part of a cooperative of outreach workers. So I am the only outreach worker at Homeless Healthcare, but there are other outreach workers who are working for different entities within Chattanooga. And so I partner with them through this cooperative called the Regional Outreach Cooperative, and we work together to share the load and to meet people where they are all throughout the county, like I mentioned. And so we have a Facebook page at Regional Outreach Cooperative Chattanooga, and we have an Amazon wish list on there with some of the items that would be helpful for people to receive as far as hand warmers, sleeping bags, tents, blankets.
This is a big time of year for people to be kind of cleaning out their closets and getting ready for the new year.
Correct.
Obviously, you want people to have good quality things, but if you happen to have a brand new sleeping bag that your kids never used, should they bring it to you?
Sure.
Or do you just want new?
Gently used and new. And as far as clothing goes, we don't really have the capacity to take those things, but those things can go to the Chat Foundation at the thrift store there, and the clients that we see are able to access those things to get the clothing is donated.
So are you a standalone, or are you affiliated with the health department? Or you talk about the Chat Foundation? Are you?
Sure. So as far as homeless healthcare goes, we're part of the Hamilton County Health Department.
Okay.
And we're kind of a standalone clinic from them, but we have our oversight from there.
We've talked about the life component more than we really have the healthcare component, but I'm sure the end goal for everybody in this situation is to help these people not have to be stuck in the situation they're in.
Correct.
So if you're getting sick a lot, that's going to be an inhibitor for that. So what kinds of health care do you provide?
Sure, so we're addressing those things as far as diabetes, high blood pressure, just those chronic illnesses that people experience, and help them manage those things, because if those things aren't managed, then truly your health can fall apart given the conditions that you're trying to survive in very quickly.
Do you help families, or like do children receive care from you as well, or just adults?
Yeah, from birth to elderly, we see it all. And so anybody that's currently experiencing homelessness, our doors are open to you. And another thing that comes with this weather is people that are unsheltered are truly trying to stay warm by any means, and so they're setting fires and may not be doing that in the most safe way, and so we usually see an uptick in burns and things like that need to be addressed, and occasionally frostbite even. And so yeah.
Well, while you're sitting by the warmth of your fire, then, if you go to their Facebook page, which is
the Regional Outreach Cooperative,
that's where you'll find that list, that Amazon wish list, if you will, and think about how cold it is outside and how hard it would be to be struggling in that.
Yeah.
So how easy to spend a few dollars and help somebody who could really need it.
Absolutely.
Thank you, Joe.
Thank you.
There's more to come here on 3+U, free exercise classes through the UT Extension. June Pewett's going to get us moving next.
Want to win some cash from our forecast? Enter our 3-degree